Hello and welcome back to the Self-Actualization in the Age of Crisis chapter summary series. I'm your host, Ron Rivers, and today we're going to be exploring chapter 3, Systemic Actualization, subsection Healthcare. Now I want to emphasize this video is going to primarily focus on the why that healthcare should be one of the 8 dignities. For a detailed analysis of the how, please check out the book or listen to the audiobook chapter in the link below. So when we talk about healthcare as one of the 8 dignities, it essentially translates as every individual having access to the highest quality medical care and treatment, regardless of where they are on the planet, right? Regardless of birth lottery. The importance of the health and well-being of the individual take priority over any government, any system, or any tools that we can create, any economic schemes that we can create. We are prioritizing the human being over our own creations. It's no secret. Our present systems, our present forms of organization around healthcare prioritize a relatively few profit seekers over the well-being of the majority. Now, I want to emphasize, healthcare as an 8 dignity is probably the one that we are closest to realize. The United States being the major holdout and primarily the major catalyst for the disenfranchisement that exists today. We are the only, in the US, the only industrialized nation that does not have a universal health care program. And there is a wide swath of data, of public feedback that indicates both the need and the greater efficiency and cost effectiveness of having a public healthcare model. We should emphasize from the start that our for-profit model of healthcare fails patients and doctors alike. In the United States, we pay on average about twice as much for healthcare collectively and individually as any other industrialized nation. Now, despite paying all that money, the United States has on average double the amount of chronic illness than any other nations in the OECD. We rank number 1 in avoidable deaths and people entering our hospitals for preventable causes. A socialized healthcare model or a global public work would save the United States about 13% of our total annual expenses around healthcare. It's over $400 billion a year. I also want to emphasize that the private healthcare system and insurance intentionally denies access to the most advanced forms of care and treatment for individuals. So I spent a small stint in my career working for a multi-state ophthalmology practice as like a VP of business. And essentially, the surgeons were unable to use the laser technologies, right? So they're more accurate and they're safer because insurance would only cover the scalpel technologies, hand cutting the eye. So when we talk about for-profit insurance agents who get to dictate the quality and safety of individual care, we notice just the inherent insanity of our present arrangements. Doctors in the United States spend about 4 times more time, effort, and capital than doctors in Canada dealing with insurance companies. Nursing and staff spend on average 20 plus hours a week dealing with insurance companies and facilitating all the paperwork that has to go through it in the United States. If US physicians had the same costs as Canadian physicians to run their practices and the same procedures, they would save on average over $20 billion a year. Now, arguments for the privatization of healthcare often focus on performance, but as I detail in the book, there is no discernible difference between private hospitals and public hospitals in relation to the care and performance of the patients, with one exception. Private hospitals, and this is especially accurate for public hospitals that get purchased and they become private, is they stop offering services that are less lucrative, for example, in-home care, and favor the recommendation and proliferation of more expensive treatments like surgery. So I want to be clear that the staff and doctors are encouraged to drive more people to procedures that make more money instead of prioritizing what is best for their personal care and well-being. That is what a private system of healthcare does. It perverts the incentives and the purpose of the system, and which is why a global public healthcare DAO is so necessary. Healthcare is one of the 8 dignities recognizes that good health and access to care are fundamental to individual actualization. Without it, we lack the security to fully embrace our time experience and instead have to just struggle with all these ancillary things that, again, only serve to enrich a select few.